The success of secondary prevention can't be stressed enough. It's really as important as acute cardiovascular care.
In our patient population here, there was a reduction of mortality by about 50% in the first 2 years.
We just need to create the awareness to make everybody aware that it makes a difference.
We have to increase the awareness of the patients about, and also maybe of the physicians about the necessity of such programs.
The only way to get access to them, to get them to accept, is if they realize that you're actually caring for them and not for a mass of patients.
We should put more effort to secondary cardiac prevention, not only because it saves lives, but it saves money. Money that we desperately need in cardiology to put in new techniques. They are very expensive, and new potent drugs that we need to get our patients, give them a better future.
ESC, as a society which is dedicated to reduce its mission to reduce the burden of cardiovascular disease, is very much concerned with the fact that there are still quite a lot of patients who don't follow what it's recommended by the guidelines as secondary prevention after an acute myocardial infarction.
There is a urgency for action because the scientific evidence shows that the recurrence of these events is exceedingly high, about 20% in the first year. So this rate of recurrence is unacceptable for us.
What we need to do now is better understand why that is the case and what is preventing us from implementing secondary prevention evidence in clinical practice.
And that's the reason why we are putting together this program. On one hand, to increase the awareness, to work together with some of our associations, like the Prevention Association, our Nursing Council, as well as our association dedicated to the acute cardiac treatment, because altogether we can improve awareness, but also we can improve the implementation of some of these rules that are very important for secondary prevention of myocardial infarction.
There is a need for action to be much more aggressive in our preventive strategies in order to implement in the clinical practice all these behavioral changes, such as including physical exercise in a routine life, choosing a healthy food, quit smoking.
Why is this important for physicians working in acute care? Well, there's very good evidence that the best this secondary prevention plan is started as early as possible. The best is actually implemented.
Well, there's good evidence out there that we can achieve targets, and evidence from large trials where we take an interdisciplinary approach to prevention, and nurses are coordinating, leading or delivering secondary prevention initiatives have shown good results.
We can do a lot. Even in the acute phase, we can start educating the patients, and definitely we can set the plan for the optimal secondary prevention, and that needs to be started in the acute phase.
We know what works in secondary prevention, a multidisciplinary work where every member of the team is engaged around guideline-based care.
We can improve patient management not only in the acute setting but also in the chronic setting, and that's very important for proper patient management and also for having an impact in terms of the community, which at the end will be very important for individual and for the community as a whole.